Thanks for your time this afternoon. I want to make a brief statement at the start and then we'll go for some questions. I want to talk today about the current restrictions on doctors ordering tests for COVID-19. This is the nose swab test in Western Australia. Currently, we are under prohibition of ordering the test unless the patient has symptoms of recent fever or sore throat, or if they're coming in for certain ear, nose and throat type procedures. The AMA sees this as an unnecessary restriction on what doctors do. It was done originally at first on the basis that there weren't enough testing kits, you will remember, in Western Australia to test the people that we thought were at high risk. That's no longer the case. We have huge numbers of testing kits now, and we think that these restrictions are offensive in that they threaten to fine doctors many thousands of dollars for ordering a test which they believe professionally and their opinion is indicated for a patient. So the circumstances where we want to be free to do this is if patients are coming into hospital for some sort of serious procedure, in order to make sure that that patient doesn't undergo a procedure when they are developing a COVID infection. We understand that is unlikely at the moment because the current situation doesn't seem to be much in the way of community spread and we don't have a lot of cases. So the figures that are quoted are maybe 1 in 20 or 1 in 30,000 people will be asymptomatic with the disease and might come into hospital. We do an awful lot of procedures. If a patient has a procedure before they get symptoms and they're developing COVID, that can be devastating for them, for their health, because you can have a bad outcome. It can be devastating for the facility that they go to, as we've seen in northwestern Tasmania. And it can be devastating for the healthcare workers who may contract the disease from that patient. So far we've got 14 that I know of. I think there are more, but around 14 or more healthcare workers in Australia who've contracted COVID whilst at work, not in other locations or due to travel. We need to stop that from getting any higher. The other reason why a doctor may want to order the test for someone who doesn't meet the fever or the sore throat criteria is because COVID doesn't always present that way. What we're learning is that this disease can mimic other problems, and a trained physician needs to be able to exclude COVID as the cause of, for example, heart attack type symptoms or bowel problem symptoms. So those are things that physicians understand. They're ready to test. The pathology companies are ready to test. The government is not going to be paying for these tests because it can be paid for by the hospital or through the system. So we don't understand why the government's standing in the way of this in such a high-handed fashion of saying there'll be thousands of dollars worth of fines if we order a simple COVID nose swab. The other reason we think that it's a good idea, apart from making patients sick, healthcare workers sick and shutting down hospitals, is that it gives us other information that's useful for the community, which is if we screen all of these patients who are coming in over the next few months and we find that none of them have the disease, that's a very useful piece of information. If we find some of them do, that's also very useful. The other instance in which this is important is when you have vulnerable healthcare workers who are trying to decide whether or not to remain working. Very important that we keep our workforce, whether it's nurses, doctors or orderlies or whoever in the hospital system, they're all making their own personal choice. Is it too risky for me to stay here? One example would be George O'Neill's Naltrexone Clinic, which does amazing work in the community, helping some of our most vulnerable people who are in the throes of trying to get off some of the worst drugs that we know rip communities apart. Now, George O'Neill's entire operation will be shut down immediately if someone goes in there with COVID. All of his workers pretty much are retired medical practitioners from usual course of practice who donate their time. These people deserve our protection by being able to screen the patients that are coming in to see whether they, in the very unlikely event, are positive for COVID, and then they can protect themselves. The other area that my members are getting quite uncomfortable at the moment is a fairly high-handed approach from the Canberra experts groups around what kind of PPE protection they're allowed to use. We have just seen this week the ICEG group, the Infectious Diseases Expert Group in Canberra, ask all of the colleges and societies, our learned institutions, to submit their guidelines on PPE to that group for approval, and then asking them to change them in pretty much every instance to make it less protection for workers. This is something about which there needs to be a big conversation in a democracy, particularly one that's grappling with this disease. For example, our members are now being told that doing CPR does not generate aerosol. It's not something that is likely to need an N95 type mask, so you'll be fine with a surgical mask. That's all very well for people who don't do CPR for a living to keep people alive to say that. I don't know that many of them have been involved in the workplace where after working a 12-hour shift all night and trying to resuscitate 5 or 6 different people, you get another one come in and you then have to work in a very messy situation with fatigued staff in an overstressed system. We need to give these people every protection that they ask for, not just what a group of experts in Canberra think they need. We need our workers to stay physically as well as mentally well in what is often a subpar workplace under a lot of stress. None of the guidelines around PPE mention the illness of the workers, and we need to take into account that we have many people who are working as nurses, doctors and so on who have immunosuppression and other medical problems such as diabetes or heart disease. We want these people to keep working because frankly we need them. We've lost a lot of our overseas trained doctors who tend to be the support, the backbone for our system, certainly provide a lot of the leave for people who work in our public hospitals, and so we need to really take proper care of people who have their own medical problems and who want to be able to front up to work to help you, the general public. It was good to see the Tasmanian Premier come out today and say no one should get blamed out of the report of what happened in northwest Tasmania, that the healthcare workers were just going to work and doing the right thing, and that the patients should not be blamed either. That was very healthy. Too many times we've seen politicians and others blame patients, blame healthcare workers for catching a virus. It's not as simple as that. The world's a very complex place. Healthcare systems are very complex, very difficult places to navigate, and we should not be blaming anyone. So in conclusion, I'll just say that doctors and healthcare workers are professionals who add value. We should be listening to them, not putting artificial barriers in their way and taking away their PPE.